The Facts on Vaccination by Anastasia, Sydney, and Ashraf. Firstly, what type of vaccines are out there? Live vaccines contain a version of the living virus that has been weakened so that it does not cause serious disease in people with healthy immune systems. An example of a live vaccine is the MMR vaccine. Even though these vaccines are very effective, not everyone can receive them. Children with a weakened immune system, for example, those who are undergoing chemotherapy, cannot get live vaccines. An inactivated vaccine is another type of vaccine that is made by inactivating the virus during the process of vaccine production. The inactivated polio vaccine is an example of this type of vaccine. Often, multiple doses are necessary to build up and maintain immunity. Vaccines could also be toxoid, subunit, and conjugate. Now that we've looked at how vaccines work, we will focus on the social impacts of vaccination. Herd immunity is one of the most important factors in preventing an epidemic breakout of a disease. Another thing vaccines can do is prevent antibiotic resistance. Microorganisms are becoming increasingly resistant to antibiotics, resulting in serious infections in patients, leading to months in the hospital or even death. Now, we will look at the economic benefits of vaccination. To get a more professional opinion, we're here at Stranraer Medical Center to talk to Dr. Evans about vaccinations. What are the possible side effects of a vaccine?
Well, theoretically, any foreign substance entering the human body, there's always a chance for an allergic reaction. At any injection site, once again, theoretically, there's always a risk of infection. But immunizations can also cause a febrile response. But I think all of these negative reactions, when you look at it from a number standpoint, it's really negligible.
Some people believe that vaccination can cause autism. Is this a myth?
It's really and truly a myth. Unfortunately, Andrew Wakefield, the physician who made this statement against vaccinations, I think he looked at 9 children, published some very, very, very unscientific data to the Lancet, which published him because he previously had a fair amount of significant work and studies, but information was forged. I think the unfortunate thing with the whole vaccine autism controversy in developed countries now with media, we tend to listen more to celebrities and their opinions as opposed to hard statistical facts. We're not versed in statistics and scientific engagement, but we are versed in television and following public figures.
This is Andrew Wakefield, a former doctor and researcher who published falsified data that correlated the cause of autism to vaccinations. Since then, he has been banned from practicing medicine.
I really think vaccination should be mandatory. If you look at the benefit-risk ratio in terms of outcome, preventing serious illness, it should be mandatory. And we've already set precedents. In schools, something as simple as peanut butter. You know, my kids aren't allowed peanut butter in school because of the very small risk of anaphylaxis. And we know vaccines work, and we have years and years of evidence. We have eradicated a lot of serious illnesses with vaccines. So why not make it mandatory if we can make it mandatory that we cannot serve a peanut butter sandwich in a school?